our next topic is on health-related law, which we kind of touched upon a little bit in the last topic. The aim of the strategy to support PAHO member states on strengthening is appropriate to the respective national context. Greater coordination between health authorities, the legislative branch of government, and other authorities in formulation, implementation, or review of health-related law. Here with us this morning to talk about that is our very own Heidi. She, Heidi Jimenez with a lot of experience in this topic, as well as Javier Vasquez. So thanks for joining us this morning.
Pleasure.
And if you could tell us, why is it so relevant for the region to adopt a strategy on health-related law initiatives?
Mm-hmm. Well, thank you so much, Derek, for having us. We're very, very excited. You know, within the Office of Legal Counsel, we have during this last year promoted this strategy, which in our opinion is very, very important. And why is it important? The organization hasn't had a strategy on this area for over 40 years. The last resolution that was adopted was back in 1970. And we are now looking at a different paradigm, a different way of delivering technical cooperation and truly impacting our technical cooperation at the country level, making it effective and making sure that it's properly implemented.
Right.
And in our opinion, one of the most important ways to ensure implementation not only of the technical cooperation, but in many cases, the legal obligations that many of our member states already have by way of treaties that they have signed, is through implementation of corresponding law and the corresponding regulations that apply health-related policies. So this is truly, as we see it, a landmark. A landmark opportunity, and we're very, very excited to be able to work with the member states to have this approved.
Thanks, Heidi. Javier, what are the main lines of action of the proposed health-related law strategy?
Thank you. There are 4 lines of action that are promoting the right to the highest attainable standard of health in laws. And one of the main strategies, the lines of actions, is the better coordination between the legislative branch and the health authority in order to cooperate in the development of health-related laws. Another line of action is the promotion and development of health-related laws and regulations to promote health determinants of health, and also to promote the collaboration with other sectors of the government: education, transportation, agriculture. A third line of action is the promotion of health-related laws and regulations to reach universal healthcare and universal coverage. And this is a very important area because also health laws and regulations can promote access to medicines and technologies. And there is a fourth line of action that is the dissemination of health-related laws information in the context of the legislative branch, the judiciary, the ministries of health, also other ministries, through different tools and model legislations and other instruments of human rights law and international law. So the dissemination of health-related law among the different branches of the government is very important in this strategy.
Thank you, Javier. We're a little bit short on time today, so just the last question I'd like to ask you, just in terms of what is one of the biggest challenges in the region in terms of that we're facing in terms of health-related law?
Well, I think that, as Javier mentioned, one of the primary focuses of the organization right now is what we call universal health.
Sure.
That relates to access. That is certainly one of our primary focuses. Additionally, given the importance of NCDs and the risk factors that really are having such a huge impact of the health of our continent, we are also focusing on risk factors related to health. So I would say those 2 elements are fundamental in our strategy. Of course, there's many, many other areas, but we wish to highlight at least those 2 areas. So it's universal access and risk factors and NCDs.
Javier, anything to add to that?
Anything else?
Well, I would like to add that there's an area where this reform of laws and the formulation of laws and regulations is very important, and is the area related to risk factors. And for example, how to use the tax legislative powers in order to protect health and also to reduce risk factors in the context, for example, of tobacco control or in the context of alcohol use. So that's another important area.
Sure. Javier, Heidi, thank you very much for joining us and giving us a lot of insight into this very important topic. And
Thank you, Derek. It's a
continue to
pleasure.
work on this.
Thank you very much.
Very
Thank you.
committed.
Thank you.
you.